If a young man, a young woman is watching the show, young family, and they have a newborn child, African American family, or how would you suggest, what would you suggest them, how should they raise their newborn child in this America we live in, knowing the things you just told us, and we know this, we live it. How would you do that?
You try to tell people. I mean, first of all, no one should have to tell anybody how to do that. It's all over everywhere. It's very, very apparent and very, very clear based on modern science around, say, the prevention research we've done on HIV, the prevention research we've done on violence, prevention research we've done on teenage sexuality. And it's clear from, again, ancient literature that in order to adequately raise children, you need certain things. It should be apparent that children, well, in ancient texts they didn't know why this was, but they could observe it, so they didn't really need to know why. Children develop from, their brains develop from the bottom up and from inside out. And as a result, the part of the brain that develops first are the very primitive, feral, fight, flight, or freeze, animalistic, early parts of the brain. The last part of the brain to develop is the frontal lobe, which is the thinking, judgment, wisdom, thoughtful, discernment part of the brain. So children, by virtue of how they grow and develop, are all gasoline and no brakes. And so if you're going to raise a child, you've got to be the brakes for that child until that child can develop its own brakes, i.e. grow up. The brakes that should be around children are villages, also known as social fabric or social capital, so that it's not just the parents, the mother and father, raising the child, but it's the entire community raising the child. So that's one core thing. The other core thing is that children get sick, children have needs, and there are different qualities of resources, so that if a child gets an infection and there's no medication to treat that infection, that's a problem. So children need access to modern technology to grow up healthy and safe. Polio shots, measles shots, pertussis shots, all of those things. And not just biotechnical technology, but also psychosocial technology. There are also ancient technologies in the Bible, in the Quran, in the Bhagavad Gita, in the Tao Te Ching, in the Dhammapada. There are ancient technologies where people have written about how to treat people and how to treat children. So that's the second thing. The third thing is that children need connectedness or good relationships or attachments. They need to have good relationships with people, so that when they get that break, they won't respond with negativity, but they'll respond with receptivity. And that's a connectedness issue. Children need a sense of power, a sense of models to understand how things work, a sense of uniqueness, which translates into self-esteem. Children also need social and emotional skills. A social skill is how do you talk to somebody to resolve conflict and yet maintain a decent relationship. An emotional skill is how do you control your anger How do you regulate your affect? Those things are taught and learned. Children also need safety, which is also known as an adult protective shield. They need to be protected from themselves and to some extent, although to a lesser extent, from other people. And lastly, children need to learn how they can deal with and minimize the trauma that they experience in life, because you cannot get out of life without being traumatized. And people don't know how to deal with that frequently. But you need to know how to take that traumatic helplessness that people experience and turn it into learned helpfulness. So if you read any of the research on how do you prevent children from being HIV infected, being violent, being prematurely sexually active, using drugs, those 7 things are talked about. If you look in the Bible, if you look in the Quran, if you look in the Bhagavad Gita, if you look in the Tao Te Ching, if you look at Native American folklore, you find that it's there. I mean, it's been there. It's the same stuff. It's not new. So when you ask me, has my mission changed? No, it hasn't changed. It's the same. Try to give people that context so that they can be okay. The mission of the Community Mental Health Council is saving lives, making a difference. And that's what we've been doing for 35 years.